Thank you, Presiding Officer. I want to thank everybody who was involved in this inquiry. I am a Health and Social Care and Sport Committee member myself. Fundamentally, this Health Inequalities inquiry, which, as we've heard already, has involved numerous committees of this Parliament, and it has shown one crucial factor. That is that the Scottish Government is doing everything it can to tackle the root causes of poverty and associated poor health, but it has one hand tied behind its back by not having control over reserve powers which currently sit with Westminster. The policies of the Tories in Westminster are having a negative and long-lasting consequences that directly impact on the health of low-income households here in Scotland. That is clear and it is evidence-based. Game-changing policies like the £25 per week Scottish child payment can only do so much when the Tories continue to inflict harm on the most vulnerable in our society, namely those relying on the safety net of the state. Just give me a wee second. You know, the people that are relying on the safety net of the state, a safety net which is being systematically dismantled by the Westminster Government, and I will give way to Brian Whittle.
Brian Whittle.
Very grateful to the member for giving way. Would you not accept that the Scottish Government have total control of the biggest tools in the toolbox to tackle health inequalities? That is health and education. And in both of those, you are failing. You are failing.
Emma Harper.
Great. Why do you say last year?
Okay, so as the member is still intervening from a sedentary position, we didn't have control of the budget. That is the bottom line. We need the finance in order to deliver what we need to do in order to tackle poverty and support health inequality. Our report, our committee's health inequality report, it shows that successive UK Conservative governments, particularly in the 1980s and from 2010 onwards, insisted on austerity agendas and on slashing welfare payments and public services. Austerity, and I think it's important to state this, is, and I quote, difficult economic conditions created by government measures in an attempt to reduce public expenditure. Austerity caused by political policy choices. The report reflects, I've only got 5 minutes, the report reflects that the austerity agenda has caused continued and immense damage to the health of the poorest and most vulnerable. Austerity has been an economic failure, but also a health failure. During our inquiry, we heard how experts from the Glasgow Centre of Population Health showed that nearly 20,000 excess deaths in Scotland were likely to have been caused by UK government economic policy. And Tory austerity policies have likely caused more deaths in Scotland than COVID-19. Dr David Walsh, and so here's the evidence that members might want to listen to. Dr David Walsh from the Glasgow Centre for Population Health said, "We must remember that these are more than just statistics. They represent hundreds of thousands of people whose lives have been cut short and hundreds of thousands of families who have had to deal with grief and aftermath of those deaths." The UN Poverty Envoy, I'm continuing with my evidence, I think I'm going to run out of time if I take another intervention. The UN Poverty Envoy, Olivier de Schutter, has also warned that another wave of austerity might violate the UK human rights obligations and increase hunger and malnutrition. Matthew Taylor, Chief Executive of the NHS Confederation, said, "The country is facing a humanitarian crisis. Many people could face the awful choice between skipping meals to heat their homes and having to live in cold, damp and very unpleasant conditions." But since Matthew Taylor stated this, we are seeing the reality of eating versus heating. It's not a choice anymore, because folk are not eating their homes and they are missing meals. Families are omitting their meals. So, Presiding Officer, the inquiry shaped the committee's many recommendations, and Gillian Martin has said this already. Areas from employment, education, housing and social security, public services and health, they're all covered in many portfolios. The recommendations fundamentally call for urgent coordinated action across all levels of government in the UK to tackle health inequalities in Scotland. So the committee was particularly concerned that the rising cost of living will have a greater negative impact on those groups already experiencing health inequalities. including those living in poverty and those with a disability. One of the key findings for me is that there is no overarching national strategy for tackling health inequalities in Scotland. But the evidence submitted to our inquiry shows that many instances where the design and the delivery of public services may be exacerbating inequalities rather than reducing them. So I'm conscious of the time, Presiding Officer. It's clear from our report that many causes of health inequalities do lie with policies made at Westminster, and so I welcome the Government's commitment to accept the majority of the Committee's recommendations, and will work together to tackle health inequalities in Scotland. Thank you.